When the diaphragm contracts, lung volume dash A. Increases. B. Diffuses. C. Decreases. D. Compresses. The answer is A. Increases. The diaphragm is a thin sheet of muscle that separates the thoracic cavity from the abdominal cavity. At rest, it is drawn upward into a dome-like shape under the lungs. When the diaphragm contracts, the dome flattens out, which increases the size of the thoracic cavity. The negative pressure allows the lungs to expand and fill with air, causing an increase in total lung volume, inhalation. What chamber of the upper respiratory tract is shared by both the respiratory and digestive systems? A. The pharynx. B. The soft palate. C. The esophagus. D. The sinuses. The answer is A. The pharynx. The only chamber of the upper respiratory tract that is shared by both the respiratory and the digestive systems is the pharynx. The pharynx is the part of the throat that is immediately posterior to the mouth and the nasal cavity, and superior to the trachea, larynx, and esophagus. Which of the following is not a division of the pharynx? A. The sonopharynx. B. The oropharynx. C. The nasopharynx. D. The laryngopharynx. The answer is A. The sonopharynx. The pharynx is made up of three divisions: the laryngopharynx, the oropharynx, and the nasopharynx. There is no portion of the pharynx called the sonopharynx. Which of the following pairs of sinus is absent at birth, and is not fully developed until puberty? A. The ethmoid sinus. B. The frontal sinus. C. The sphenoid sinus. D. The maxillary sinus. The answer is B. The frontal sinus. The frontal sinuses are not present at birth. They begin to develop in the first few years of life, but they are not fully mature until after adolescence. The sphenoid, maxillary, and ethmoid sinuses are present at birth, though they are underdeveloped and similarly do not mature fully till late childhood or adolescence. Which of the following is a flap of cartilage that covers the opening of the windpipe during swallowing to prevent aspiration? A. The cricoid cartilage. B. The hyoid. C. The tracheal cartilage. D. The epiglottis. The answer is D. The epiglottis. The small flap of cartilage that covers the windpipe to prevent aspiration during swallowing is the epiglottis. It is located at the base of the tongue and attached to the entrance of the larynx. Which of the following maintains the lumen of the trachea? A. Air pressure within the respiratory tract. B. The tracheal cartilages. C. The infrahyoid muscles. D. The cervical spine. The answer is B. The tracheal cartilages. The lumen of the trachea is maintained by the tracheal cartilages, a set of approximately 20 separate C-shaped rings of hyaline cartilage. The non-continuous cartilage allows for greater flexibility during inspiration and expiration. Which of the following best describes the epithelium of the trachea? A. Pseudostratified columnar cells with cilia and goblet cells. B. Stratified squamous epithelium with cilia and goblet cells. C. Cuboidal epithelium with cilia and goblet cells. D. Transitional cells with cilia and goblet cells. The answer is A. Pseudostratified columnar cells with cilia and goblet cells. The epithelium of the trachea is made up of pseudostratified columnar cells with cilia and goblet cells. What structure is directly posterior to the trachea? A. The pharynx. B. The thyroid gland. C. The esophagus. D. The cervical spine. The answer is C. The esophagus. The esophagus is directly posterior to the trachea, and the cervical spine is posterior to the esophagus. The thyroid gland is anterior to the trachea. The pharynx is superior to both the trachea and the esophagus. What does the trachea bifurcate into? A. Left and right primary bronchioles. B. Left and right secondary bronchioles. C. Left and right secondary bronchi. D. Left and right primary bronchi. The answer is D. Left and right primary bronchi. The trachea bifurcates into the left and right primary bronchi. This occurs at a location called the carina, which is at the level of T4-T5. A nurse is about to perform an upper respiratory exam on a patient with sinusitis. Which of the following sinuses are inaccessible for assessment by physical exam due to their placement deep within the skull? A. The maxillary and frontal sinuses. B. The maxillary and sphenoid sinuses. C. The ethmoid and sphenoid sinuses. D. The frontal and ethmoid sinuses. The answer is C. The ethmoid and sphenoid sinuses. The only sinuses that can be assessed on physical exam are the frontal and maxillary sinuses. The sphenoid and ethmoid sinuses are too deep in the skull to be assessed via physical examination.